Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. Today we're going to talk about setting posterior teeth. So after checking the quality for the upper and lower setting, we begin by the first step in adding posterior teeth. We are going to begin with tooth number 6. Tooth number 6, which is the first molar, is the biggest tooth in the arch, and its location is a bit to the mesial, so it's in between the mid of the upper 6 and the distal of the 5. So after marking where its location should be, we open a box for the tooth and then we set it into the location. So the first step is putting the tooth in correct relation with the upper in terms of cusp interdigitation. Once more, please observe your morphology. So the tooth is put into place. We check with the upper that the location is correct in terms of cusp interdigitation. And we just want to also point that once you're working with the upper and then go to the lower, make sure your wax is totally cold. So what are we doing now? We are raising the tooth in location to increase the interdigitation between the cusps of the upper and the lower. So within its setting, you will find that on the mesial it's almost with the occlusal plane of the wax, but distally it's following the 6 going up. Why? Because we had curve of Spee. So after we put it into place, and we put the cusps in location buccally, and we make sure it's in location. The mesial cusp of the lower is in between tooth number 6 and tooth number 5. The distal cusp is a bit less than the distal cusp of the upper molar. So it's larger than mesiodistally than the upper molar. So it extends for a longer period. After setting from the buccal side, now we're watching the tooth from the lingual side, and what we're trying to do is raise the tooth lingually so its cusps interdigitate and go up towards the palatal cusps of the upper. So that's the lingual interdigitation of tooth number 6. So now that tooth number 6 is finished, we could go either to the back or to the front. Meaning that we can set tooth number 4 and 5, or we could set tooth number 7. They're equally the same. And notice that now after we have set tooth number 6, that the wax that we are removing now is some space for tooth number 5. But before we have removed it, the upper premolar was touching on this wax. So each time before I remove any wax, make sure it's still touching. So tooth number 5 will interdigitate with upper tooth number 5. So we put it into location. We open a box just enough for it. And once more, the upper cusp will go down. So tooth number 5 is in between tooth number 5 and tooth number 4. So it's in location now. We're trying to orient it, raise it to increase the interdigitation with the upper, tilt it from the buccal, and now we're going to tilt it from the lingual. The same we did with tooth number 6. We are trying to raise the cusp of the lower 5 from the inside to embrace the upper cusp. So the interdigitation of both cusps are now best, and the orientation of the root is correct. Now tooth number 4. Now in the case that you're setting for patients, the selection of the size of the teeth is important, that you select a size suitable for the patient. The tooth that usually sometimes or that could have a problem while setting is tooth number 4. After adding tooth number 6 and 5 from back and the canine from front, sometimes we don't have space for tooth number 4, so it's the most common tooth that we trim to make it a bit narrower. So first we remove the wax for tooth number 4, which is the lower premolar. And we try to put it, we find that it doesn't have any place. So to make the tooth fit, we're going to use a handpiece. We're going to trim using the tungsten carbide there, and we have adjusted the speed of the unit at 20. We don't want a high speed because we don't want the tooth falling off while you're trimming. So we take out the tooth. Where am I allowed to trim? I'm allowed to trim first. I begin trimming at the mesial and distal of the tooth. If I find that the morphology of the tooth is going to be ruined and I'm losing a lot of the marginal ridges, I could also remove from the mesial and distal of tooth number 5 if I need. So I begin at first the mesial and distal of tooth number 4 from both sides, while still looking at the occlusal table that the marginal ridge is not reduced significantly. We have more than half of the marginal ridge. If I find that the occlusal table will be ruined and the tooth becomes abnormal in shape, we can also remove from tooth number 5 as well. So now we could also remove from tooth number 5 mesially, and this will also give us extra space. Remember that when you remove, the surface will be very straight, so make a roundation. So go slightly to the labial and slightly to the lingual to reduce the straight shapes and return back the tooth with curves. So it's not a straight cut onto the tooth surface. So go back and make it round. And then we try to fit it in place. We're trying to measure it. It's still not going in, so I could trim a bit more. How do you know it's fit in place? Once we close the articulator, we want to make sure that now it's fit with the upper without any space between the posterior teeth. So it went into place, and we are trying to just orient the roots of the premolars of the lower are also upright as they were in the upper. So, like at tooth number 6, there is no space. Tooth number 5 is in contact and with no space. So that makes sure that we have added the tooth in the correct position. And we slightly rotate it to meet the canine. So it meets the canine. In the lingual side, this depends on the morphology of your tooth set. Some teeth set come with lower 4 without any cusp. You remember that tooth number 4 in natural dentition, the lingual cusp is underdeveloped. It's not like the lower 5. So if it's underdeveloped and you get the set where the first premolar is closer to the canine, we don't do lingual adjustment. But if the morphology of your teeth on your set of teeth has a lingual cusp, we interdigitate it with the upper as we did with the second premolar. Now go back to tooth number 7. Tooth number 7 will be following the curve that we have created, curve of C in the upper. So we are trying to put place for it in the lower here. If you find that you don't have place for tooth number 7, once more you can trim it from the distal. But before trimming tooth number 7, let's go back to the sequence. Remove wax first, then reduce the base plate, and then reduce the tooth if it needs reduction. So if the tooth is touching the base plate, let's follow the rules that we have done for teeth that don't have space, and that is trimming from the wax first, and then trimming from the base plate, and then trimming from the tooth itself. Okay. Before closing, we just made sure that the upper wax, no wax is present extra, and now the tooth goes into contact with the upper 7, and once we finalize it, we go lingually and fit it into place. So we finalize its tilt, we remove excess wax, we make sure it's interdigitating with the upper perfectly. If it's not, we just raise it from beneath. So I stab the knife beneath it, and we go lingually, and watch what to do. We try to take the tooth up by raising the lingual cusps to embrace the upper. Okay, so the tooth totally is with total contact with the upper 7. So we make sure the interdigitation, I could see no space between the teeth, and now also I don't see them buckling. So that's how we set lower posterior teeth into location, and we find that the lower posterior teeth, the central fossa of the lower posterior teeth are almost over or slightly lingual than the crest of the ridge. In our first design, we put the palatal cusps of the upper on the crest of the ridge, so the central fossa is where the palatal cusps of the upper lie, and they are straight in one line and with the central ridge line. What we're doing now is finalizing. Remember that sometimes while you're adding a tooth or two, the position of the teeth change, so always revise your position of the teeth while you're doing your work. Fix them into place securely with warm wax. Fill in the interdental papilla areas. Add more wax if needed. Clean the teeth and submit them bilaterally. All teeth are present on both sides. Thank you. So now we're going to begin the cleaning of the wax. Make sure that the fitting surface and the sulcus is totally clean. The sulcus should be totally clean from any wax. And that makes, once we finalize the wax on both sides, we are now ready to do a step called wax up or festooning, which is adding wax to mimic the gingival tissue around the teeth. So it's not, the occlusion is not only composed of teeth position, it's also composed of designing, after we do the wax up of the teeth, adding the teeth in the wax rims, we should also begin designing our denture surface to be smooth and concave and mimicking the gingiva of the denture of the patient. Assalamu alaikum. In this lab, we're going to talk about what we call final wax up of the denture or festooning. We're going to begin with the upper. When we were doing the teeth in location, we were designing the occlusal table of the denture. And as we said, that has specific rules for each tooth, how to be located in the arch. But later, we need to design the polished surfaces. Remember that the polished surfaces once become smooth and concave, they will help stabilize the denture. So we want the morphology of the surface smooth, continuous, and mimicking the gingiva. So what are we doing first? The first step is adding wax. Joining from the teeth surface, we're adding wax from the labial surface of the teeth up to the base plate. So it's a continuous flow of wax all around, but it's not straight. We add it in a concave form. So we're filling in any spaces in between and preserving that it is concave. Once more, please notice that we need to make sure that none of our work or our molten wax is going to the fitting surface or the sulcus of the denture. So we fill in more wax because the concavity is still large. We're going to reduce it. Now we're filling in, after we filled in between the teeth and base plate, we're filling in the interdental papilla. What is the interdental papilla? It's the gingiva running between the teeth. So it goes into the embrasure of the teeth. So we now need to add wax, molten wax, and we let it flow in the concavity between the teeth by a hot instrument. The additions we're adding are still arbitrary, and then we're going to carve them further into the form of a true gingiva. Make sure that we also add wax posteriorly until it becomes smooth. We try each time to remelt the surface and remove the junctions between each addition and its next one. For the distal surface, we try to make a continuous line running from the distal of tooth number 7 up to the hamular notch. We expose 1 to 2 millimeter of the distal cusps of the 7, but from there down in a straight line in all directions. So after it cooled down a bit, the addition is done all around, and we also add palatally in the same way. So this is buccally, now smooth and continuous line. Now we do what we call we're going to begin carving the grooves. So we melt the wax a bit. Make sure they're smooth, and then using a lacron carver, we're going to carve grooves. If you notice your teeth and you look at your teeth in the mirror, you will find the grooves are present from the centrals around the lateral a bit and more prominent around the canine. There is a canine eminence in the crown, and it follows that it has also a root eminence. So just that the wax has cooled down, it had cooled down. We're making sure that we have straight lines running from tooth number 7. So it's straight lines. Make sure it's cold before we begin. We also scratch the surface until it becomes soft. And then we go around the teeth. We make sure each tooth labial surface is totally exposed. We remove any wax going on the teeth itself. And we are running on the interdental papilla. We don't want it swollen. We want it flat from tooth to tooth. So how do we do it? We go from the labial of one tooth to the labial of the other, and the wax remaining is the wax enough for the tooth. We don't want it extra or bulging. So we run from one labial surface to the other labial surface, and the remnant of the wax is what is left. In between is the interdental papilla that we want. Why should we leave it flat between teeth? Because we do not want plaque to accumulate. If we carve extra, what will happen is that this will be a plaque retention area. So we don't remove a lot of interdental papilla. We're just enough to make them smooth and continuous after exposing the whole labial surface of one tooth and the other labial surface of the other tooth. Okay? So suppose there is food, it will not accumulate. Now we further carve on the curve that we have, which is the roots of the central and the root of the canine. So the wax over the canine has a slight groove running, resembling the area where the root of the canine is present. So as if there is a root, okay, and it flows. The root of the latter is not apparent, but the root of the canine is more apparent. Premolars up to the molar, you can create these grooves in the wax. Once we finish, we just use a final shine to the teeth to give the buccal surface a shape that is similar to the natural morphology. So up to the molars, we can create grooves. After that, it's straight from the tooth number 7 backwards up to the hamular notch, with the surface is smooth and concave around. Accentuating the grooves, we're accentuating the groove a bit vertically. We make the junctional line beneath the crowns, not only the root groove but also the junctional line. Which is the line running from keratinized attached tissue to the gingiva. The line demarcating the gingiva from the attached mucosa over the root area. And then we invert the lacron carver upside down, and we make sure we clear the line, the gingival line of each tooth. Okay? So you will have like a gingival margin. So the wax is not totally smooth with the tooth. It's not beveled with the tooth. You have a very small step called gingival margin. We create it by inverting the lacron carver. And going down. And then after we exposed all the labial surfaces of teeth, we're going to do the polish. The margin is not thick, it's very thin. It's just to resemble the natural morphology of the gingiva with the tooth. If it's thicker than this, it's just like 0.5 millimeters. If it's thicker than this, it will accumulate plaque once this becomes a denture, so we don't want it to accumulate plaque. And so once all of the teeth are exposed, we use the flame. We use the flame to make it smooth and shiny. If you can run it once more, come on. So we run it on the flame quickly, just to give it a shine. And then using a brush, we're waiting it to cool a bit, and we create this effect on the surface where it becomes even further smooth, and we make sure that the surface has no lines, scratched lines. And then we give it another shine on the flame. And that's our work on the labial surface, and you can closely see the shine on the surface resembling natural teeth. Now we're going to repeat this work on the lower and on the palatal tissue. Thank you. The effect of the gingiva, stipple gingiva appearance, okay? And the final shine.
والله اخذ لك كوان بس انا ما راح الحق اكمل. اليوم هسه طيب هي احنا ما شفنا الفيديو.
انا عضلة جاي فريدة يعني ما خلينا نكمل اليوم. نعم. طيب.
لازم يضل بعدين ما يصير شيء.
لا عندي زيتها عندي 3 ربع. طب نبدل؟ لو الكلية وسمعت؟
نعم.
ارجع سيما.
شو أستاذ خلاص؟
لا لا خليك خليهم شوي.
لسه بدي شوية تصديق بعدين بروح. في عادي احنا نصور ديمو. بعرف ودت ديمو اللون ودت لي مرتين ناس بس انه
خلصنا.
العربي